Have you ever wondered how a small gland, the size of a walnut, can have such a profound effect on a man's health and well-being? The prostate may seem insignificant at first glance, but its role in sexual health, urinary function, and overall vitality cannot be overstated. In today's video, we'll explore the life-altering impact prostate issues and prostate surgery can have, particularly for men over 60. Understanding these challenges is essential for not just the person undergoing treatment, but also for the families and caregivers who support them. Stick with us until the end to learn how to navigate the physical and emotional hurdles of recovery, and why it's crucial to approach this journey with resilience and informed support. Let's dive in. Throughout this video, you'll gain a comprehensive understanding of the prostate's vital role in the male body and how prostate issues such as cancer or benign prostatic hyperplasia, BPH, can lead to major decisions like prostatectomy, a surgery that removes the prostate. You'll learn how this surgery can affect not just physical health but also sexual function, emotional well-being, and quality of life, challenges that extend far beyond what the medical community might tell you. We'll delve into how urinary incontinence and sexual dysfunction can deeply affect a man's sense of identity and relationships. This video will offer insight into the emotional resilience required to cope with these life changes, particularly for men over 60 who face a slower recovery and greater risks due to age-related health conditions. We'll also discuss the critical role of rehabilitation, therapy, and support networks, helping viewers understand the multifaceted recovery process. By the end of the video, you'll know how to approach this journey with hope, patience, and a renewed sense of control. To fully comprehend the profound impact that prostate issues have on a man's life, it is crucial to first grasp the prostate's essential role in the male body. The prostate, a small gland roughly the size of a walnut, is located just beneath the bladder and in front of the rectum. Although it may appear insignificant in its size and location, this humble gland performs a function of immense importance, producing the seminal fluid that transports sperm during ejaculation. While the prostate itself is not absolutely essential for survival, its contribution to sexual health, urinary function, and overall well-being cannot be overstated. Its removal or dysfunction can bring about a wave of physical, emotional, and psychological challenges that extend far beyond what the medical community may initially reveal. When faced with prostate diseases such as cancer or benign prostatic hyperplasia, BPH, many men are presented with the option of undergoing prostatectomy, the surgical procedure that involves the partial or total removal of the prostate gland. For many, the decision to pursue this surgery is an emotional one, driven by the need to preserve life and well-being. However, prostatectomy's consequences reach far beyond the physical health of the patient, affecting their overall quality of life and deeply influencing their emotional state. The effects of prostate removal often stretch into the heart of a person's identity, affecting their self-image, sexual health, and sense of personal dignity. Even though the surgery may be necessary to save lives, the road to recovery is paved with emotional struggles and dramatic physical transformations that require immense resilience to navigate. One of the most immediate and distressing post-operative effects is urinary incontinence. This condition can range in severity from minor leaks during physical exertion or laughter to a complete loss of bladder control, leading many men to feel frustrated, humiliated, and isolated. The loss of control over something as basic as urination has the power to strip away a man's sense of autonomy and dignity. It forces him to rely on absorbent devices or suffer the emotional toll of anxiety about public accidents or the fear of being perceived as less than. Medical studies suggest that nearly 50% of men experience some degree of incontinence after prostate surgery, though it often improves with time. Still, the emotional burden of urinary incontinence can weigh heavily on a man's mental health, leading to feelings of inadequacy, depression, and a loss of confidence. Rehabilitation, including pelvic floor exercises like the well-known Kegel exercises, can assist in regaining control, but the journey toward healing is often slow, uncertain, and fraught with moments of doubt. It requires patience, persistence, and a great deal of emotional strength. Alongside urinary incontinence, another significant challenge faced by many men following prostate surgery is the loss of sexual function. The intricate network of nerves responsible for sexual response runs very close to the prostate, and during surgery, these vital nerves can be damaged or severed, leading to a diminished ability to achieve an erection. For many men, this loss of sexual function is one of the most emotionally devastating aspects of the surgery. It impacts their sense of masculinity, intimacy with their partner, and overall self-worth. The ability to perform sexually is a core element of many men's identities, and losing this function can cause feelings of deep sadness, frustration, and even anger. Even though nerve-sparing techniques have been developed to minimize the risk of erectile dysfunction, these techniques are not always successful, and the likelihood of erectile dysfunction increases with age and the man's sexual health prior to surgery. The emotional weight of this loss cannot be underestimated, as it can profoundly affect a man's relationships, his mental health, and his quality of life. For those who experience erectile dysfunction after prostatectomy, there is hope for recovery, but it often requires a long and uncertain path. Many men find that sexual rehabilitation, medication, or even support devices can help them regain some degree of function, but the recovery process is rarely quick or easy. For some, the emotional pain of accepting this new reality is far more difficult than the physical recovery. The constant tension between hope and disappointment, the push and pull of regaining lost abilities, can leave a man feeling defeated and hopeless. Yet, many men find that with time, therapy, and emotional support from loved ones, they are able to rebuild their sexual health and their confidence. In some cases, sexual rehabilitation may help restore a sense of intimacy and connection with a partner, though it requires patience, understanding, and often a redefined sense of self. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. The journey after prostate surgery is not merely about overcoming physical challenges. It is about rebuilding a life that has been fundamentally altered. Men who undergo prostatectomy must not only cope with the loss of physical function, but also grapple with the psychological and emotional toll it takes. The recovery process often involves much more than just the body. It is about navigating the emotional aftermath, seeking support, and finding new ways to define one's identity in the face of these profound changes. The emotional resilience required during this time is immense, and the support of loved ones, medical professionals, and counselors can make all the difference. Ultimately, prostatectomy is a life-altering event, touching every aspect of a man's existence. It serves as a reminder of the profound interconnection between physical health, emotional well-being, and the quality of life. Understanding these effects is crucial not just for those who undergo the surgery, but for the families and communities that support them. The road to recovery may be long and difficult, but with determination, support, and self-compassion, many men find a way to heal, not just physically, but emotionally as well. Reclaiming a sense of control, dignity, and hope is possible, even in the face of such life-changing challenges. And through it all, the human spirit remains incredibly resilient, capable of overcoming even the most daunting obstacles. Undergoing a prostatectomy later in life presents unique and complex challenges, as the recovery process tends to be slower and fraught with greater risks compared to younger men. As the body ages, its ability to heal and adapt diminishes. This reality makes it all the more vital for older individuals contemplating prostate surgery to receive personalized, comprehensive advice that thoroughly explores the specific risks and benefits unique to their age group. Understanding these factors is essential in making an informed decision, as the implications of prostatectomy are more pronounced for older men, both physically and emotionally. The surgery itself carries an elevated risk of complications in older patients. As people age, they are more likely to have existing health conditions such as heart disease, hypertension, or diabetes, which can complicate both the procedure and the recovery process. These underlying conditions can make anesthesia less predictable, prolong healing, and increase the likelihood of adverse effects post-surgery. Moreover, these pre-existing health issues may demand additional attention and management, requiring more frequent monitoring and specialized care. The interplay between age and health complicates the rehabilitation process, making it even more crucial for older patients to be aware of these factors and seek guidance on how to manage their overall health during recovery. Beyond physical health concerns, the emotional toll of prostatectomy on older men can be profound and multifaceted. For many, the effects of surgery go beyond the immediate physical changes and deeply impact their mental health and sense of identity. One of the most challenging emotional hurdles is the feeling of loss of vitality, control, and, for many, their sense of masculinity. Incontinence, a common post-operative effect, can trigger feelings of embarrassment, frustration, and helplessness. The inability to regain urinary control or the need to rely on absorbent devices can erode a man's sense of independence and self-worth, creating a sense of vulnerability that may feel foreign and difficult to bear. Moreover, the changes to sexual function that accompany prostatectomy can deeply affect an older man's sense of self-esteem. For many, sexual health is inextricably linked to their identity and emotional well-being. Losing the ability to maintain a satisfying intimate relationship can lead to overwhelming feelings of isolation, inadequacy, and sadness. The loss of sexual function, whether through erectile dysfunction or diminished desire, is often viewed as a symbol of aging and frailty, something that can be particularly difficult for older men to accept. The emotional challenges that come with these changes can be even more pronounced when compounded by the physical recovery process. What's more, older men may feel that their relationships, which often have a long and intimate history, are being altered in ways that are out of their control. As the body struggles to heal, the mind must also grapple with these significant emotional hurdles. Anxiety and frustration can intensify, and feelings of depression or grief are not uncommon. The combination of physical pain, loss of function, and emotional distress can create a powerful sense of helplessness that, if left unaddressed, can undermine the recovery process. However, with proper emotional support from family, friends, and healthcare providers, older men can work through these feelings and regain a sense of balance and purpose in their lives. Therapy, counseling, and support groups can provide invaluable tools for navigating these challenges, offering men a safe space to express their emotions and receive encouragement from those who understand their struggles. In addition to the physical and emotional hurdles, the rehabilitation process itself can be more complicated for older patients. Mobility issues, which are common among older adults, may hinder their ability to perform the necessary rehabilitation exercises that help improve urinary continence and sexual function. These exercises, such as pelvic floor strengthening, are crucial for recovery, but they require time, persistence, and physical strength. For those with limited mobility or existing physical limitations, achieving the desired outcomes from these exercises may be more difficult, leading to frustration and a sense of discouragement. These challenges necessitate specialized care and adaptive strategies to ensure that older patients can still engage in rehabilitation to the best of their abilities. The impact of prostatectomy on an older man's life is not confined to the immediate post-operative period. It extends far beyond the surgery itself, affecting long-term health, emotional stability, and relationships. The complex interplay between physical health, emotional well-being, and sexual function can leave older men feeling vulnerable and uncertain. However, with the right approach, support, and care, many can regain control over their lives and find new ways to adapt to these profound changes. It is crucial to acknowledge the unique challenges faced by older men undergoing prostate surgery, and to ensure they receive the personalized care and emotional support they need to navigate this life-altering experience. With time, patience, and the right resources, recovery is possible, not just physically, but emotionally and psychologically as well. Studies consistently demonstrate that therapeutic interventions, such as sexual therapy and couples therapy, can have a profoundly positive impact on the emotional and physical recovery of men after prostate surgery. These forms of therapy offer men and their partners a supportive and understanding space to navigate the changes they face together. Post-surgery, many men may struggle with feelings of loss, frustration, and confusion as they try to adapt to the alterations in their sexual and emotional lives. Sexual therapy specifically helps men rediscover intimacy and find new ways to experience connection, pleasure, and closeness with their partners, which is essential for maintaining a healthy relationship after such a life-changing event. Couples therapy, in turn, fosters mutual understanding, helping both partners communicate openly about their needs, concerns, and desires. It also provides an opportunity for couples to explore new ways of relating to each other beyond the realm of physical intimacy. Emotional and physical closeness can be reinvented, helping to strengthen the bond between partners, even in the face of significant challenges. In addition to therapy, it is crucial for men undergoing prostatectomy to have a robust support network. This network can include family members, close friends, and healthcare professionals who understand the unique emotional and physical struggles that come with recovery. Support networks are vital for providing encouragement, reassurance, and practical assistance as men navigate the complexities of post-surgery life. Whether it's offering emotional encouragement during moments of doubt or helping with daily tasks during recovery, a strong network makes the healing process much more manageable. Knowing that there are people who genuinely care and are invested in their well-being can empower men to face the challenges of recovery with renewed strength and optimism. If you are still watching this video and find these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. While the risks associated with prostate surgery are undeniable, there are many effective strategies to reduce the adverse effects and make the recovery process smoother. One of the most vital components of recovery is physical and sexual rehabilitation, which can help men regain control over bodily functions that might have been impacted by the surgery. Pelvic floor exercises are particularly important in this regard, as they strengthen the muscles that control urinary function. These exercises, which may include Kegel exercises, are designed to improve bladder control, reduce incontinence, and support overall pelvic health. Though the process of regaining urinary control can take time, many men find significant improvements with consistent effort. Rehabilitation also includes addressing sexual function. Many men experience a decline in sexual performance following prostate surgery, but a variety of treatment options are available to help restore or improve erectile function. Medications such as PDE5 inhibitors, e.g., Viagra or Cialis, can increase blood flow to the penis, improving the ability to achieve and maintain an erection. For some men, vacuum devices are also an effective treatment. These devices create a vacuum that draws blood into the penis, resulting in an erection. While not all men will experience complete recovery of sexual function, these treatments can make a significant difference in restoring confidence and quality of life. Additionally, for men who experience a decrease in sexual desire, hormone replacement therapy, HRT, may be an option. This treatment can help raise testosterone levels and restore libido, energy levels, and general vitality. However, it's crucial for any decision regarding hormonal therapy to be made in consultation with a specialist, as hormone replacement comes with its own set of risks and benefits that must be carefully considered. Testosterone therapy, in particular, must be managed under strict medical supervision, as there are potential side effects, such as an increased risk of blood clots or prostate issues in certain cases. Working closely with a healthcare provider ensures that the treatment plan is personalized to meet the patient's unique needs, health conditions, and goals. Making the decision to undergo prostatectomy is never simple. It is a deeply personal, complex, and often emotional process. For some men, the choice is clear, as prostate cancer or other serious prostate conditions may leave surgery as the best or only viable option. For others, it may require weighing the potential risks and benefits carefully, as the decision involves not only physical health but also emotional, social, and psychological implications. Doctors play a vital role in this process by providing an honest and thorough evaluation of all possible treatment options. They must take into account the patient's age, overall health, personal goals, and any pre-existing conditions that could affect the outcome of the surgery. Having a complete and clear understanding of what to expect before, during, and after surgery is essential for men to make informed decisions that are in alignment with their values and health objectives. At Sabia Vages, Sexuality and Health, we are deeply committed to helping men navigate these difficult decisions with clarity and confidence. We strive to provide comprehensive, accurate, and honest information so that each individual feels empowered to make the best choices for their health and well-being. We believe in the importance of providing ongoing support to those affected by prostate surgery, ensuring that they have access to the resources they need to achieve a healthy recovery. Life does not have to come to a halt after a prostatectomy. In fact, with the right care, rehabilitation, and emotional support, many men go on to live fulfilling and satisfying lives post-surgery. The path to recovery may be long and at times challenging, but it is possible to regain a sense of vitality, intimacy, and happiness. With physical rehabilitation, emotional healing, and an empowered mindset, men can rediscover the joy of living and reclaim their sense of well-being. Our commitment at Sabia Vejes, Sexuality and Health is to walk alongside men throughout their journey, providing the tools, knowledge, and compassion they need to move forward with confidence and hope. Life after prostatectomy can indeed be full, meaningful, and filled with new opportunities for growth, connection, and fulfillment. It is never too late to embrace a new chapter and live life to the fullest, no matter the challenges faced. So, what have you learned so far about the impact of prostate issues and surgery on men over 60? Is there something in particular that stands out or resonates with you? We'd love to hear your thoughts. Comment below with one thing you've learned today and how you plan to bring it into practice in your life. If you like this video, please leave your comment, and don't forget to like, share, and subscribe to our YouTube channel, Sabia Vejes. We're committed to helping you understand health, sexuality, and overall well-being at every stage of life.